This is a CDC Covid-19 update, or a coronavirus update. We're going to look at some of the most recent medical information we have about the coronavirus, and we're also going to look at how the United States is doing as far as confirmed cases. So let's start with the most recent information we have. And unfortunately, it's not a very good thing. We have here from the CDC, Covid-19 can spread 13 feet and it can travel on shoes. Neither of those things are very good. Looking here, we now have evidence from a new report by the CDC that the coronavirus can travel up to 13 feet in air, which just so happens to be more than twice the social distancing guidelines given by the CDC themselves. So we're told to be 6 feet apart from each other, which is a good idea. But here we have the coronavirus can go more than double that in the air. It is important to keep in mind this is a maximum distance. So this is not saying that if someone has the coronavirus and they breathe in your direction that you're automatically going to get it if you're 13 feet or less. It just means it's a maximum value, so it's something we should be aware of. And this is one of the reasons why it's actually a good idea to wear a mask if you go in public. And it's why the federal government and the CDC are recommending that you do that. No, it's not perfect, but it's by far better than nothing. Even if you don't have a surgical mask, you can just use a bandana or whatever you have, and it's going to be better than not having anything. They've also pointed out that the coronavirus can stay on shoes, which is really unfortunate. So here we have that they were looking specifically at hospitals and ICUs where they're treating people with the coronavirus. What they found was that floor swabs of an ICU had a high rate of positive tests for coronavirus, and half of the ICU staff's shoes also tested positive. This isn't really a big deal for most people in your house because if you have coronavirus and your family members have it, you're probably going to interchange already and you may already be immune to it. But it is a big deal when you're looking at places like hospitals, especially for those workers. What we see here from the CDC again is that it's potentially high-risk infection for medical staff and close contacts. And that's because if it can travel 13 feet in the air, but it can also stay on the floor in such a way that it tests positive for coronavirus, that is just another thing to be aware of and to try and clean as good as possible. So we now know that the coronavirus can travel up to 13 feet in air. Again, that's a maximum value, but it's possible. And it can also stay on your shoes and get on your floor, which can be tested positive for coronavirus. Now, since we're here in this video, let's just look at how the United States is doing as far as total cases. Right now, as of the time of this recording, we have 612,000 confirmed cases in the United States and almost 30,000 deaths. Compared globally, there are almost 2 million confirmed cases, which if you're good at math, you'll recognize that the United States is almost 1/3 of the total confirmed cases in the world. In this case, it's not really that good to be number one. However, our death ratio is actually quite a bit lower than a lot of other countries. That even though we account for 1/3 of the total confirmed cases, we account for less than 1/4 of all of the deaths, which means that we're doing better when it comes to treating coronavirus than some other countries. Again, these aren't good numbers, I'm not trying to say they are, but they are quite a bit less than we were told they could get to about a month ago. Do you remember the first report said that they could be as high as 1 to 2 million casualties in the United States? And now the reports have been downsized, so we're looking at maybe 60,000. 60,000 is still a lot of people to die, but it is worlds better than 1 to 2 million. So even though the numbers are really big, we're still actually doing a fairly good job at containing and at mitigating this virus. Hopefully we're on the downturn. It seems like in many cases like New York, we should have already peaked. So if that is the case, things will get better before they get worse. Anyway, that's it for this video. I just wanted to give you a quick update of where we stand and what's going on. Hopefully it's been beneficial to you, and if it was, make sure you like, subscribe, do all of those things that YouTube always asks you to do. Thanks for watching, and I'll see you next time.